We are pleased to welcome Brian Gragnolati, who is President and CEO, Atlantic Health System, and Chair-elect of the American Hospital Association. Good to see you, Brian.
Good to see you. Thank you for having me here.
By the way, Atlantic Health System, describe the hospitals within the system.
Well, we have Morristown, Overlook, Newton, Chilton, and Hackettstown, as well as our rehab hospital.
You're actually one of your colleagues, Mike Marin from Holy Name, and they received an award that you received from the federal government. 5 stars for what and from whom?
From CMS, and we're real thrilled about that. It's about the quality of care we provide, and Mike's got a great organization.
Let's talk about this. Some of the challenges. I'm curious about this. While all sorts of folks, when we talk to in the healthcare industry, talk about the challenges they face, innovation is key. There is a physician-led network that you're involved in called what?
The Atlantic Alliance. And the Atlantic Alliance is really an opportunity for us to work with about 2,500 physicians who are still independent to help them improve quality and access to care and coordination of care.
Why does that matter?
You know, healthcare is about teamwork, and we're only going to do better if we work together. And I think as we've gone through these changes in healthcare, particularly over the last 5 or 6 years, you're seeing this divide between physicians who choose to stay in private practice as well as physicians who choose to become employed. And what we're trying to do is bridge that gap because everybody's got a role.
Brian, you've talked a lot about the importance of access to quality health care. A, what does it mean? And B, what's the problem?
Yeah, so I think access is really in 2 parts. One is access to insurance, and then the second is access to care. And we need to work on both of those as a country. And that's what the ACA was trying to achieve in one of its parts.
The Affordable Care Act,
yes,
otherwise known as Obamacare.
Right. That's what it was trying to achieve, was this notion of access both to insurance and care. But the second part was about the affordability of care. And we need to work on all of those parts moving forward.
You know, the other part of this that fascinates me in the hospital-related programming we've been doing is the role of technology. How important has technology become, and will it continue to be, in providing quality health care, A, and B, in the way medical information is shared? Loaded question, I know.
Yeah, but you know, that's a great question, because when people think about technology, they think about what I did this morning, which was be in an MRI to get my Achilles tendon
Like, no
scanned.
joke, this is for real.
Yeah, yeah.
Well,
so
we
that's
hope everything works
technology.
out, but go ahead.
That's technology,
But
right?
it's more than that.
It is more than that, and people don't often see that. Technology right now, think Amazon, okay? Think about how Amazon has really transformed the relationship that a consumer has with a retailer. In healthcare, each and every day, part of getting a better result is better communication, meaning everybody's connected on a health record, everybody sees the next step in their information. But more importantly, how do we use technology to drive waste out of the system, reduce the friction that patients feel when they intersect with the system, and provide better outcomes? That's the exciting part. There's a ton of innovation going on in that area, and we're part of that.
Well, you know what's fascinating to me about that whole question is electronic medical records, a piece of a much larger equation. What does it actually mean? I mean, I don't want to get ahead of myself, but I've been confused by what it is and what it's not.
Sure. In very simple terms, an electronic health record is, you know that chart that's in your doctor's office?
Yes.
That's now available to all the folks that are caring for you in a common way. There doesn't have to be that physical transfer of information anymore. It's there electronically. At Atlantic, we're in the process of fully implementing Epic, which is our electronic health record, and we're spending $180 million to do that.
Why? Why make such a huge capital investment?
It's about safety and it's about quality. The more information that next step in your care is given, it means you're going to get a better outcome.
You know, Brian, we've talked to several hospital executives, and I often ask the question about public policy. You have this national role. By the way, tell everyone what the American Hospital Association is, and then I'll get to the question about policy.
Sure. I'm the chair-elect of the American Hospital Association. We represent the 5,000 hospitals and health systems in this country. We're based both in D.C. and Chicago. And when you look at all the analysis of those types of organizations, we are rated as the most influential group on the Hill.
In that context, what is the appropriate, in your mind, the appropriate role of the federal government, including Congress, you smile as I speak, in terms of making healthcare policy, creating healthcare policy, and undoing certain healthcare policies?
Sure. I think
And where shouldn't they be?
Yeah,
I'm sorry.
yeah. I think if you think about that from who pays for health care, and you begin to add up all the pieces, right? About 65 to 70% of health care is paid for by taxpayers. People always think about Medicare and Medicaid, but what about military medicine? What about retirees and dependents? What about government workers, state, local, federal? And when you add all that up, that's about 60 to 75% of the spend. You've got employers as the other roughly 30 or so, and then you've got some self-pay people. So when you think about policy, it's policy in general, but it's really about payment because it's taxpayer-funded health care.
Do you think the policymakers are often thinking about the payer in this?
No.
Does it feel like they are?
No, I think that's where we get lost in this equation. Imagine if the government, on behalf of its taxpayers, thought about it as purchasing that amount of health care. Wouldn't we design the system differently?
It would look different, Brian?
It would look different. It would work differently because the fundamental problem we have in the payment of health care is how fragmented it is today.
Final question. Is this the job you thought being a hospital CEO would be, A, and B, how much does it change every day?
So I started in healthcare as an emergency medical technician, working on an ambulance when I was putting my way through college. I am pleased and privileged every day to do what I do, but it's an entirely different world now.
You love this job?
I love it.
1
absolutely.
to 10?
10 plus.
With all the frustration.
You know, where else can you every day help a community over and over again, be healthy, be safer, and be happier? I love it. I love what I do.
Brian, we appreciate you joining us. Come back as the healthcare landscape continues to change every day. We appreciate it. Stay right there.
Thank you so much.
Stay right there. That is it for this particular edition of State of Affairs. Now let's continue the conversation. Follow me on Twitter at Steve Adubato, and I promise, God willing, we'll see you next week. Take care.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by TD Bank, the New Jersey Education Association, Georgian Court University, Choose New Jersey, New Jersey Sharing Network, Verizon, and by NJ Best. Promotional support provided by NJ Biz, all business, all New Jersey. And by Insider NJ.